Guys, welcome back. Today we will discuss about endocrine glands functions and hormones released by endocrine glands. So what is endocrine glands or what is the function of endocrine gland? That we will see first. Endocrine glands is a system of glands that secrete hormone directly into bloodstream. The functions are it regulates metabolism, growth, development, tissue function, sexual function, reproduction, sleep and mood maintenance. The endocrine system works like a chemical messenger system coordinating various body function through hormone release. It's vital for maintaining internal balance that is known as homeostasis. And in this image, clearly you can see the type of endocrine glands. Now we will see the different endocrine glands. They are hypothalamus glands, pituitary glands, thyroid glands, parathyroid glands, adrenal glands, pancreas, pineal gland, ovaries in female, and testes in male. I'll repeat again hypothalamus gland, pituitary gland, thyroid gland, parathyroid glands, adrenal glands, pancreas, pineal gland, ovaries in females and testes in males. Now we will see in detail hypothalamus. Hypothalamus is releasing some hormones. They are TRH, CRH, GnRH, GHRH, somatostatin, and dopamine. The expansion we will see in next slide. TRH, CRH, GnRH, GHRH, somatostatin, and dopamine. The major function of this gland is to control pituitary gland and maintain homeostasis. The major disorder is affecting are hypothalamic dysfunction, tumors, Kalaman syndrome. Now we will see the expansion of that hypothalamus releasing hormone. They are GRH, GHRH, etc. So GHRH means growth hormone releasing hormone. GnRH means gonadotropin releasing hormone. CRH means corticotropin releasing hormone. TRH means thyrotropin releasing hormone. Dopamine means dopamine. All right. So these are all the hypothalamus releasing hormone. Our next gland is pituitary gland. So for this pituitary gland, there are two lobes. They are anterior lobe and posterior lobe. Anterior lobe is releasing some hormone like ACTH, TSH, LH, FSH, and GH. And posterior gland also, or posterior lobe also releasing some hormone. They are known as ADH and oxytocin. The major disorders can see in pituitary gland abnormalities are pituitary adenoma, acromegaly, diabetes insipidus, and hypopituitarism. So all these disorders will discuss in detail in another video. So the hormone released by anterior pituitary in response are GH or growth hormone, FSH and LH. FSH means follicle stimulating hormone and LH means luteinizing hormone. Then ACTH means adenocorticotropic hormone. TSH means thyroid stimulating hormone. PRL means prolactin. So these are all the major hormones released by hypothalamus and pituitary gland. Hypothalamus by GHRH, GnRH, CRH, TRH, and dopamine. Pituitary glands anterior lobe by GH, FSH, LH, ACTH, TSH, and PRL. Now we will see effect of this hormone. This GHRS and GH or growth hormone releasing hormone and GH or growth hormones goes directly to your long bones and the big muscles to stimulate growth. Gonadotropic hormones and follicle stimulating hormone and luteinizing hormone travels to gonads in males. Okay, these hormones will travel to gonads in males. Okay, in males, LH or luteinizing hormone causes the testes to make testosterone, and FSH follicle stimulating hormones control sperm production. And in females, LH and FSH control or luteinizing hormone and follicle stimulating hormone controls menstrual cycle and trigger the release of an egg from the ovary. So there are different functions in each group of people. Like in male, LH causes the testis to make testosterone and control sperm production by FSH. In female, LH and FSH control menstrual cycle and helps in the release of an egg from the ovary. Then the CRH or corticotropin releasing hormone and ACTH or adenocorticotropic hormone or ACTH travels to adrenal gland and it causes your adrenal glands to release stress hormone cortisol and regulate metabolism and immune response. Next, TRH or thyrotropin releasing hormone and thyroid stimulating hormone travels to the thyroid to release T4 and T3 or thyroxine and triiodothyroidine. Then dopamine and prolactin, it goes directly to the breast tissue to produce breast milk. And as I said in pituitary two lobes are there, anterior lobe and posterior lobe. Anterior lobe releasing adenocorticotropin hormone, thyroid stimulating hormone, luteinizing hormone, follicle stimulating hormone, growth hormone, and prolactin. And these hormones are responsible for various functions, responsible for the entire functioning of the body. And because of these reasons, pituitary gland is also known as master gland. Then next gland is thyroid gland. Thyroid gland releases thyroid hormone T3, T4 and one more hormone called calcitonin, T3, T4 and calcitonin. And the major function is regulate metabolism, growth and development. And the disorders are hyperthyroidism or hypothyroidism. Hyperthyroidism means increased hormone production. Hypo means decreased hormone production. And this disease will detailedly discuss in next class. Then parathyroid gland, that is other endocrine gland. Parathyroid gland we can see along with thyroid gland. So in this image clearly you can see that parathyroid gland release parathyroid hormone and it regulates calcium and phosphate balance. It regulates calcium and phosphate balance and the disorders are hyperparathyroidism and hypoparathyroidism. Next is adrenal gland. Adrenal glands has cortex hormone and medulla hormones. Cortex hormones include cortisol, aldosterone, and androgen. Cortisol, aldosterone, and androgen. And medulla hormones, adrenaline and noradrenaline. So altogether, 5 hormones are released by adrenal gland. The cortex hormones by adrenal glands are cortisol, aldosterone, and androgen. The medulla hormones by adrenal glands are adrenaline and noradrenaline. It is responsible for stress management, blood pressure maintenance, and salt balance. And abnormalities are Addison disease, Cushing syndrome, and pheochromocytoma. We will discuss these diseases in another class. The next gland is pancreas, and pancreas is releasing insulin, glucagon, and somatostatin. Insulin, glucagon, and somatostatin. These hormones are released by pancreas. And the major function is regulates the blood glucose level. And if any imbalance, that leads to diabetes mellitus type 1 and type 2 and insulinoma. So pancreas is releasing 3 hormones. They are insulin, glucagon, and somatostatin. And it regulates the blood glucose level. Any imbalance in this hormone production that leads to diabetes mellitus type 1 and type 2 and insulinoma. Next gland is pineal gland and the hormone released by pineal gland is melatonin and the function is regulating sleep-wake cycle that is called circadian rhythm. The disorder is obviously sleep disorders, pineal gland tumors. So pineal gland is releasing a hormone called melatonin. It regulates sleep-wake cycle or circadian cycle and disorder, sleep disorder, pineal gland tumor. Next is ovaries. Ovaries can see in females. In this image clearly you can see ovaries are releasing estrogen and progesterone and it regulates the menstrual cycle and also responsible for the production of ovum. Any abnormalities means that can lead to PCODs, menopause and ovarian failure. PCODs, menopause and ovarian failure will discuss detail in other class. You just focus on the hormones now. Hormones released by ovaries are estrogen and progesterone and the function also. It regulates the menstrual cycle and it helps in the development of ovum. Then testes, obviously in males, and the hormone released by testes is testosterone. Testosterone. The function is sperm production and development of male secondary sexual characteristic features. And the disorder is hypogonadism and infertility. Hypogonadism and infertility. So these are all the hormones which comes under endocrine system, and these hormones are responsible for growth, development, metabolism, cell functioning, and the entire functioning of the body. Any imbalance in this hormone production, any of this hormone production, that can lead to drastic changes and imbalance in our body. And in the summary, clearly you can see the information in a glance. So when you discuss about endocrine glands to into someone, this summary will be really helpful, the summary table. Or when you write an assignment also, you can write the number of glands, hormones, functions, common disorders like this, and that will enhance the readability, also clarity and credibility of your writing. So the glands you can write first, the major glands like thyroid glands, adrenal glands, pancreas, pituitary glands, ovaries, testes, and also the hormones released by each gland. Thyroid means T3 and T4. Adrenal means cortisol and adrenaline. Pancreas means insulin and glucagon. Pituitary means GH, TH, LH, FSH, etc. Ovaries, estrogen and progesterone. Then function. Thyroid is responsible for metabolism. Adrenaline hormones are responsible for stress response. Pancreas is responsible for glucose regulation. Pituitary gland is responsible for growth and other growth. Ovaries are responsible for menstrual cycle and the disorders. So this summary table will really help you to remember also. If you write everything in a table and if you're trying to by heart it, that would be good. Then in conclusion, endocrine system plays a vital role in our overall health, and early identification of any endocrine disorders can improve patients' outcomes. Hope you understand, guys. So these are all the endocrine glands which is responsible for the entire growth, development, function of our body. Of any abnormalities means that can create lot of problems in the body, and early identification of this hormonal imbalance is very essential. Proper screening, proper diagnosis is essential. The person is suffering from any kind of disturbances like tiredness, weakness, hot flushes, sleep disturbances means definitely we have to go for blood test. From the blood test, clearly we'll understand is there any abnormalities, and that will help to take early treatment, and early treatment will prevent severe complications. Hope you understand, guys. Thank you. Next time with other condition or other nursing diagnosis. Thank you, guys. Bye-bye.